Our resolution is Resolution 1, and it's Transparency in Medical Student Financial Aid Reporting. And this resolution addresses the fact that medical student financial aid is often overly aggregated for students that have no debt or have the most debt, and we wanted schools to be able to report more meaningful numbers for applicants so they can decide where to go based on an accurate debt indebtedness number. And so we've asked the AMA to work with the AAMC to ask schools to produce these numbers for applicants and for current medical students.
Two, we would like to reaffirm the statements of the reference committee that this issue be studied further to figure out the barriers to financial aid transparency before we go ahead with our recommendations.
Thank you. At the University of Toledo, for example, they mentioned that the average student was burdened with $150,000 worth of debt, and that includes the people that were borrowing the maximum amount of money and people that had external support. I think there's definitely a big problem in lumping everyone together, and I think the author's resolution would really do a lot to address that.
My resolution is quality improvement education in medical schools and residency programs, and essentially it's a resolution that is asking the AMA to take an advocacy stance on the issue of quality improvement education. In terms of quality improvement, the idea behind the resolution is to educate medical students and residents, who are the future doctors of America, about trying to improve the system in which we work to improve quality metrics, essentially the outcomes, better patient care delivered with existing treatments that we have.
My resolution is titled The Implementation and Funding of Child Care Services for Patients, and basically I came up with this idea. It's a new resolution that I decided to propose to the AMA that first identifies childcare as the barrier that it is to access to care, and second, in terms of advocacy, for the AMA to advocate for funding so that where it's feasible across the country, institutions can start offering these services.
The data that they present is unconvincing. The stated fact that 13% of women delay medical care because of inadequate child care services, that percentage is unquantifiable.
The preliminary reference committee report only addresses the logistics for emergency room child care, while the resolution encompasses primary care as well, which we feel would benefit the medical community.
Yeah, the debate is definitely important. I think the REFCOM, by bringing their recommendations and allowing individuals to give testimony, a lot of delegates actually get more involved on the issues. I think it's great to have both sides express their opinion, reach a common consensus, and in the end benefit medical society.